Hello everyone. Today's presentation is about the topic atrial enlargement ECG features. First of all, what is atrial enlargement? Atrial enlargement is when the heart's upper chambers become abnormally stretched or thickened due to prolonged high pressure or volume. In this condition, the both atriums, the left atrium and the right atrium, are getting enlarged because of some kind of pressure or volume overload. There are three types of atrial enlargement that we are going to see in the ECG. The first one is the left atrial enlargement, second is the right atrial enlargement, and the third one is the biatrial enlargement. First, we are going to see about the left atrial enlargement. So, left atrial enlargement is due to pressure or volume overload of the left atrium. It is caused due to hypertension, valvular heart disease like mitral stenosis, mitral regurgitation, or aortic stenosis. The next cause is atrial fibrillation, left ventricular dysfunction, or cardiomyopathies. The ECG features of left atrial enlargement are as follows. Left atrial enlargement produces a broad bifid P wave in lead 2, which is also called as the P mitral, and enlarges the terminal negative portion of the P wave in V1. So we know the normal P wave is monophasic in the limb leads like like lead 1, lead 2, and lead 3. But in V1, we know the P wave is usually biphasic, and in this condition, left atrial enlargement, the P wave in the lead 2, it is bifid, and it is more than 40 ms between the two peaks, and the total duration of the P wave is more than 110 millisecond. And also in B1, it is biphasic. The P wave is usually biphasic, but the negative terminal is giving a amplitude which is more than 1 mm. We know the normal amplitude of the negative terminal is 1 mm, but in the left atrial enlargement, the negative portion is getting greater than 1 mm. So in this diagram, you can see the normal P wave in lead 2 is monophasic and it is normal, and in V1 it is biphasic, and in the condition of the left atrial enlargement it is bifid, and in V1 you can see the negative terminal is getting deeper than 1 mm. The second is the right atrial enlargement. So right atrial enlargement means your heart has an abnormally large right atrium. This upper chamber of your heart receives oxygen poor blood from your body. So the causes of right atrial enlargements are pulmonary hypertension, tricuspid regurgitation, atrial fibrillation, congenital heart defects, chronic lung disease, or core pulmonary, etc. So the ECG features of the right atrial enlargement are, so in right atrial enlargement, it produces a peaked P wave, which is also called the P pulmonale, with an amplitude of more than 2.5 mm in the inferior leads 2, 3, and AVF. Usually we see the lead 2 and lead V1, and in lead V1 the positive terminal is greater than 1.5 mm in V1 and V2. So we know the positive terminal of the V1 lead should be less than or around 1.5 mm. So in the condition of right atrial enlargement, the positive terminal in the lead 1 is getting greater than 1.5 mm in amplitude, and you can see in lead 2 the amplitude of the P wave should be lesser than 2.5 mm, but in this condition of the RAE, the amplitude is getting greater than 2.5 mm. So the last one is the biatrial enlargement. Biatrial enlargement is diagnosed when criteria for both the right and the left atrial enlargement are present on the same ECG. The diagnosis of biatrial enlargement requires criteria of LA and RA to be met and either lead to lead 1 or a combination of leads. So biatrial enlargement is nothing but the both left and right atrium is happening at the same ECG. So there will be both the right atrium as well as the left atrium enlarged. The ECG features of biatrial enlargement is in lead 2, you can see the bifid P wave with an amplitude which is greater than or equal to 2.5 mm, and also the duration which is greater than or equal to 120 or 110 ms. In B1 or V2, most commonly in B1, biphasic P wave with the initial positive deflection greater than or equal to 1.5 mm tall and terminal negative deflection which is greater than or equal to 1 mm deep, and terminal negative deflection which is greater than or equal to 40 millisecond duration. And the combination criteria is P wave positive deflection which is greater than or equal to 1.5 mm in lead V1 or V2, and notched P wave with duration greater than or equal to 120 meter per second, 120 ms in limb leads, or in V5 or V6. In this diagram, you can see the combination of both the right and left atrial enlargement coming together, and that's all about the biatrial enlargement. Thank you.